Whenever you come into a system of care, a healthcare system, and an educational system that is trauma informed, you should have an expectation that they will provide that sense of safety as you walked into that system of care. They will provide you with choices. They will provide you with a sense of collaborative work, that you're not just there being told what to do, but that you're there to work with that system. And most importantly, I think that system should empower you. The system should encourage you to have a voice, encourage you to have a say in the process at all times.
When children with disability have experienced trauma, they can benefit from trauma-informed care delivered everywhere in their life. Trauma-informed means providers understanding take an account to the role the trauma plays in academics, relationships, and day-to-day life. Using a trauma-informed approach can reduce trauma symptoms, increase feelings of physical, social, and emotional safety, improve academic performance, lead to better relationships and social skills, increase the ability to manage emotions, improve behavior at home, in the community, and at school. Trauma-informed services usually start with an assessment that takes a child's trauma history into account.
In a trauma informed system of care, when you come for an evaluation or you come for an assessment, an expert assessor is going to try to ask as many questions as they can with a degree of sensitivity. The more information that you provide that person will help them develop a plan of action that will be comprehensive, and it will help shape the way that the system will help you. And you should at no point should feel that you're doing something wrong by not answering all the questions. If at any given time anything that you say or anything that you get asked makes you feel uncomfortable and you decide to not share further.
When a professional is doing any type of evaluation, we always need to take into account that kids that have experienced any sort of trauma, their biological age may not match their emotional age due to the trauma that they experienced.
So they could be developmentally behind their peers. And it's different when you see somebody that on the outside may appear to be 10 years old, but developmentally may be much younger.
In a trauma-informed individualized education program, or IEP, the team considers the impact trauma has had on learning and behavior. The IEP goals should build on the child's strengths and what the child can do independently. It should address where the child's skills need to be strengthened.
IEP meetings, when I would walk into an IEP meeting, I want to know that I'm walking into a warm, friendly place.
An IEP meeting should be safe and welcoming. IEP team members should respect a family's culture and values. It's important to consider a child's history of trauma.
Consider the lighting, consider whatever trauma the person has been through to make the environment as calming and soothing as possible. Have a clear agenda and schedule. Walk the person through every step that you are doing so that the person understands and feels comfortable with the process. We need to find appropriate interpreters. The interpreter needs to be qualified, not just someone who can translate the words, because the words by themselves may not mean anything. Parents need to be made comfortable enough and understand enough to know that they can ask questions, not simply say yes. Do not leave the IEP meeting or any meeting without truly understanding what was discussed. Make sure you understand the goals that were written for your student, the services that he or she is receiving.
You want to try to make sure that you're feeling as empowered as possible, right? And then also that the child that has experienced the trauma is also feeling empowered.
I advise parents to then look for the next level up and use keywords like, I want to ensure that my child is safe. I want to ensure that my child has choice. I want to collaborate with the system of care so my child can have the best services possible, the best education possible.
I will rally in the resources And some of the things that I've done were I asked a friend to show up with me.
In today's world, we need to advocate. People do better when they have thriving families, thriving communities, and people in their corner.